So this video is about frozen shoulder. Okay, as we know, frozen shoulder is the tightness of the shoulder joint capsule, or it's called adhesive capsulitis. And the main position for the shoulder capsule gets tight is actually the inferior of the shoulder joint capsule. It's not the front, it's not the bottom, it's not the back. It's most likely it's the front inferior. And that will mostly limit the shoulder external rotation because the head of the humerus tends to move interiorly when we do external rotation or reaching back. And when we try to reach up, the shoulder goes flexion, the head of the humerus actually needs to go down like this. So they go like here and then these go down, all right? With that tightness, it's hard to allow the body or the arm to go that direction. So in addition to capsule expansion or traction, we also need to promote the downward glide and also the interior glide. And what I found that the best position to do those two joint mobility or the mobilization is in this position, because I can use the body weight to really provide good traction. I can just hook the arm or the elbow and just lean backwards like this. So I can provide this kind of position or this kind of traction for about good 30 to 60 seconds. And then with this position, I can maintain the traction force right here, use this hand, and then I can go inferiorly with my other hand. So I want to position myself that way I can use my leg to apply force, not just using the arm. So here, I'm gonna use my body to stabilize the arm, maintain that traction force. The joint is now well separated here in this position, so I have a lot of space right here. And now I'm gonna apply a little bit downward or inferior glide right here. If I feel the resistance, that's usually grade 3. I can go beyond the resistance, that's grade 4. Usually it's not recommended unless it's really, really needed. And I can do oscillation, that's grade 1 and grade 2. Those are ideal for like pain reduction or just to warm up the joint capsule. Okay, so I can do that for about 30 to 60 seconds, ideally 90 seconds, and then I can maintain that traction and go to the downward pressure. This. Okay? Now, if I want to go interiorly, I use my body to provide a little bit of traction here, and then I apply the posterior interior direction. My other arm is not gonna go with it. It's gonna go opposite direction. Actually this way. Is it okay? It's probably not the most comfortable mobilization, but it's needed for shoulder external rotation. And keep in mind, this direction is most likely the shoulder dislocation happens. You know, it happens to the picture a lot, or shoulder dislocation. Then the head of the humerus just like pop forward out of the socket. And so with that said, if someone has shoulder dislocation, what we need to do for reduction is actually opposite. So traction, separate the joint, and then put it back. You feel like, yeah, it's popping back to the socket. Usually that's what happened. All right, okay. So with those two very gentle joint mobilization, you have to build some experience with it. You know, it's not recommended for beginners. So very gentle massage the joint, the muscle, the soft tissue around the shoulder joint, and also we can do a little bit circular motion. Try to stabilize the shoulder blade so the rotation is pure glenohumeral joint motion instead of compensation of the scapula that the whole thing goes with it. A lot of times with the frozen shoulder, the shoulder blade goes with it, so it's actually not pure glenohumeral joint motion. So that's what we need to do. Stabilize it, and by hooking the subscapularis right here, and also the upper trapezius, you kind of like anchor the scapula. And then you can ask patient to do this kind of motion by themselves. Okay, small circles start with. There. And then reverse. Good. The cue for that is to let the patient bring the elbow to the ear. So it's like this way. Bring your elbow to your ear, like this, and gradually increase the radius of the circle. Yeah, it doesn't have to be fast, and the patient will probably do it more interiorly, so you need to kind of guide it there and give them a little bit of feedback. Bring it behind your ear and above your ear, and move that elbow around your ear, kind of draw a circle. Meanwhile, you still stabilize the shoulder blade or the scapula, so that will be pure glenohumeral joint movement. Remember, this is ball and socket joint, kind of like your thumb, so you should be able to do that really freely. Okay, that's one of the most freely moved joints in our body, along with the hip joint. All right, and then after that, we can kind of like do a little bit rubbing here, up and down a little bit, and then shake a little bit, flex the muscle, and also shake like this. Yeah, and kind of like do a little bit traction like this. Yeah, so that's really relaxing, okay? And on top of that, we can also put ice pack around the shoulder for about 5 to 8 minutes, and that should feel pretty good afterwards. All right? Okay, good.